Did you know that genital herpes affects 1 out of every 6 people in the US age 14 to 49? Are you aware that many people with herpes experience no symptoms at all? Let's talk about genital herpes today. What is genital herpes? Genital herpes is a sexually transmitted infection caused by the herpes simplex virus, HSV. There are 2 types of HSVs, HSV-1 and HSV-2, each causing distinct health issues. HSV-1 is typically associated with oral herpes, leading to cold sores around the mouth. It can cause genital herpes through oral genital contact. HSV-2 is primarily responsible for genital herpes, characterized by sores and blisters in the genital area. The key difference between the two lies in their preferred sites of infection and transmission methods, with HSV-1 mainly spreading through oral contact, and HSV-2 through sexual activities. When someone is infected, HSV travels to the skin surface and creates sores or blisters. Even without visible symptoms, HSV-2 can still be transmitted. After the initial outbreak, the virus retreats to the nerve cells, where it can stay dormant. It may recur at later times, often after a trigger, such as stress, illness, or sun exposure, leading to new outbreaks. The symptoms of genital herpes typically include the appearance of small blisters or sores around the genital or rectal area. These blisters can be painful and may break open, leading to ulcers that eventually scab over and heal. Before the blisters appear, some people experience tingling, itching, or burning sensations in the affected area. Other symptoms can include flu-like signs, such as fever, body aches, and swollen lymph nodes. What are the complications of genital herpes? Having genital sores raises your risk of giving or getting other STIs, including HIV/AIDS. HSV infection can cause swelling and inflammation within the organs associated with sexual activity and urination. These include the ureter, rectum, vagina, cervix, and uterus. A baby can be infected with HSV during delivery. Less often, the virus is passed during pregnancy or by close contact after delivery. Newborns with HSV often have infections of internal organs or the nervous system. Even with treatment, these newborns have a high risk of developmental or physical problems and a risk of death. Diagnosis. Your doctor can diagnose genital herpes based on a physical exam and your sexual history. They may also take a sample from an active sore or perform a lab test on your blood to confirm the diagnosis and determine if it is HSV-1 or HSV-2. How to prevent genital herpes? It's important to note that some individuals with genital herpes may have very mild symptoms or none at all, making it possible to spread the virus without knowing. Using condoms during sexual activity can significantly reduce the risk of transmission. It's also important to limit the number of sexual partners and to engage in open communication about STI status with partners. For those in a relationship with an infected partner, antiviral medication can be used as a preventive measure. Additionally, avoiding sexual contact during active outbreaks of the virus is crucial, as this is when the virus is most likely to spread. What are the treatment options? Treatments for genital herpes primarily focus on managing symptoms and reducing the frequency of outbreaks. Antiviral medications like acyclovir, valacyclovir, and famciclovir are commonly prescribed. These drugs can be used to treat outbreaks as they occur, or taken daily as suppressive therapy to reduce the likelihood of recurrent outbreaks and decrease the risk of transmitting the virus to others. Pain relief can be managed with over-the-counter pain medications and soothing baths. While these treatments can help control the symptoms and outbreaks of genital herpes, there is currently no cure for the virus. Regular communication with a healthcare provider is essential for effective management of the condition. Stay informed and take care.